Welcome to the Answers for Elders radio show. Meet the trusted experts who will give you straight answers and will help guide you on the path of later life care. Now, here's your host, founder, caregiver, and CEO, Suzanne Newman.
And welcome back, everyone, to Answers for Elders Radio Network. And we are here with Kevin Church, who is the Chief Science Officer of Athira Pharma, who is at the cutting edge of Alzheimer's research and just how we're looking forward. And I truly believe, personally, Suzanne Newman, that you guys are finding out so many amazing things that the world doesn't even know about yet. And that's the thing that really why I wanted you to have on the show. And so, Kevin, obviously, you know a lot about Alzheimer's, but there's a lot of things that medical science is still learning. And obviously, tell us a little bit about, what happens to the brain when somebody is diagnosed with Alzheimer's disease?
Yeah, that's a great question, and it's a great point. We are still learning. There's still so much. We're learning a lot, but there's still so much to know about Alzheimer's. But there's been a lot of work really in the last 20 years, and particularly the last few years, that have really shed some light on what's going on. And Alzheimer's is a very complex disease. I think that's the first thing I should say. So there's a lot of different things going on, and most people know about the amyloid plaques. So these are essentially clumps of sticky protein that abnormal should not be there in that way and in that amount. And so these clumps of sticky proteins get built up, and exactly why is not clear. That's still a question that's unanswered. But these clumps build up, and they can be toxic to the cells, to the nerves, and they get in the way of normal nerve communication, and then they eventually start causing the nerves to die. And so that leads to the neuro-degeneration that we see in Alzheimer's. And so that's a critical component of what's going on in the brain. There are other proteins that also build up. One is tau. You'll hear a lot about tau in the Alzheimer's community. It also forms these clumps that are abnormal. And then there's a lot of new research on inflammation being a major contributor to the issues to the brain health in Alzheimer's. So those are, at a high level, those are kind of what's going on in the brain of someone with Alzheimer's.
And obviously these clumps, as the brain tries to process, it obviously interferes with nerve endings, but it also connections. Is that really what happens? And it usually happens with recent memory, correct? Long-term memory is the last to be, I know, affected. Is that true? Or I'm far from the expert. I know a little bit to be dangerous here.
No, that's true. It seems that the long-term memory or memories are the last to go. Exactly why that is hard to say, but there seems to be, early on in the disease, short-term memory is usually one of the earlier symptoms. I think people start to notice, okay, where did I put my keys? What is the name of this person I just met? Things like that, that are very frequent, are kind of the first things to go.
I do that a lot.
I do it too. So it's, but it's, obviously that progresses to a point where it becomes problematic. But so the clumps, they can interrupt the communication between the nerves, and that can interrupt memory formation, which is obviously why you have some memory recall issues. But I think what's important to note in Alzheimer's is that regardless of the clumps of protein, the ultimate problem is that the nerves are not working properly and that they're dying. And so anything that can be done to prevent that from happening, we think could be very beneficial.
Yeah, obviously. And so as you have your new drug, which I'm not going to mention because I'm going to mess it up bad, but it's what it does is it replenishes nerves, is that and provides nourishment to the brain.
Right. So this is an experimental therapeutic. Of course, we're still in clinical testing, so there's still much to learn about what it could actually do in human patients. But from our preclinical studies, yeah, it's one of its main ways that it works is that it helps keep cells alive, essentially, even in the face of these challenges from these toxic clumps of proteins or inflammation. It protects the cell, protects the nerve, and it can help reestablish connections that have been lost due to the presence of these proteins or other cellular damage that's happened. So those are some of the main, and we've also, I will mention, we've also seen it help in inflammation, actually reduce inflammation in our preclinical studies. So again, a lot to learn here, but we're encouraged by what we've seen preclinically.
Absolutely. And obviously by getting diagnosed early, you have a greater chance of, sustaining your awareness and your full mind activity longer. Is that correct?
Well, we think that's going to be important, obviously, for the future as new treatments come out that might. So right now we have limited treatment options for those that are diagnosed early or in mid stages. As we, as the industry, as we're starting to see, and there's a lot of excitement in the field, kind of for the first time in a long time, is that we think earlier could be better, and that if you can start treatment earlier, maybe preserve more of the brain function for longer. Obviously, that would be a better outcome.
Absolutely.
And so it's going to continue to be important.
Yeah, and certainly with the whole process of just greater awareness, with people understanding that some of these things we may think, oh, that's just dad, or he tells the same story over and over again. And those I know that like memory loss or the short-term things like that on a consistent level is not normal, is it?
On a consistent level, no. And I would just, obviously, if there's any concern about that, to talk to your doctor. Of course, I'm not giving medical advice. I'm not a medical doctor. I'm a researcher, but usually it would go along with other symptoms, behavioral changes, and it would be, interrupting normal function.
Right.
Forgetting things every once in a while is totally normal, but if there's any concern that's happening too frequent or there's other symptoms, obviously conversation with your doctor would be warranted.
Absolutely. So if you're an adult child and maybe have a senior loved one that may be experiencing or may have just been recently diagnosed with Alzheimer's disease, what are your options as an adult child? Can you inquire about the trials? Can you do things to help facilitate?
Yeah, I mean, obviously, I would recommend to anyone actually being a caregiver or to have very candid conversations with the doctor about, and if there's interest in clinical trials or things like that, then that's the first conversation that should be had is obviously with the patient, and then with the doctor, primary care physician or specialist, and just to see if it is right. It's obviously we need volunteers in clinical trial to further the science and bring new treatments to the patients.
Yeah. And how do people get information about the trial?
So the best way is obviously a discussion with a doctor or neurologist. If they're at a specialty clinic, they usually are aware of ongoing clinical trials. Also clinicaltrials.gov. You can find any clinical trial in your area. If you're interested in our trials, you can go to our website, athirapharma.com. And really just conversations with your doctor would be
perfect.
Start.
So Kevin, you and I are going to be back, and we're going to talk a lot more about clinical trials, how you as a care partner can help your loved ones, right after this. We at Answers for Elders thank you for listening. Did you know that you can discover hundreds of podcasts in our library on senior care? So visit our website and discover our decision guides that will help you also navigate decision making. Find us at answersforelders.com.